Hi Bob, my name is Destiny. I'm going to be your nurse today, and I'm just going to be placing an NG tube to help get some of that gastric contents of your stomach. Can you please state your name and date of birth? Alright, and he tells me, and it matches my chart. Like I said, I have an order to place an NG tube. I provided privacy when I walked in, and I washed my hands. Do you have any allergies that you're aware of? He tells me no, he has no allergies, so the skin prep should not affect him at all. Alright, so all I'm going to be doing is placing a tube in one of your nares, whichever one has the best patency, and it'll just go down into your stomach. Have you had this done before? And he tells me he has. It's been a while, but he remembers that it shouldn't hurt, but it will most likely be uncomfortable. So now I'm just going to check his gag reflex as long as his nares, or along with his nares. Alrighty, I'm just going to use a tongue depressor. Alright, and he gags, so I'm going to get rid of that. And then I'm going to look in his nares. And it doesn't look like there's anything that would be occluding or in the way. Alright, Bob, now I'm just going to press down on one and have you breathe out the other. Okay, and now the other side. And what one do you feel you can breathe better? And he says the left one, so that's the one we're going to do. Take my gloves off. Wash my hands. And I have him in a high Fowler's position. And then I'm just going to get my tape ready. And then this is just for after I get the tube placed. I can tape it and secure it to the nose. And then tape my measurement. And then also when I need to tape it to the gown. Or safety pin it to the gown. Alrighty, so I am going to measure from the ear to the nose and then down to the xiphoid process. Okay. And then I'm just going to tape then where I should stop. And there are some tubing that the numbers are super easy to read, and if you feel confident you can just use that. Otherwise you can use tape. And that way at the end you can also see if there's any change in measurement from measuring from the tape to the end of the exterior tubing. So now I'm just going to apply the skin prep. So that has time to dry. Wash my hands again. And then he did have a gag reflex. And I asked him if I'm going to ask him now, do you have any problems swallowing? He tells me no. But if for some reason he's having a hard time, I can give him some water to assist the tube down. Alright, so now I'm just going to put this pad on to catch any fluid that might come out. Wash my hands again. Open up my wound. How are you doing, Bob? He tells me he's doing good. Alright, like I said, I have him in a high Fowler's position. And to start off, I am going to have him hyperextend his neck. And then I'm going to insert downward an angle. And it's going good. Once he coughs, I'm going to have him tip his head up and tuck his chin. And then advance it more. How are you doing, Bob? He says good. He's swallowing as his chin is tucked and I'm advancing. He's having no problems. Okay. Now once I reach the tape, I'm going to make sure to keep it secure until I tape it to his nose. Bring this up and around. And then bring this one around as well. And then back up. You just don't want to let go because you want the tube to be nice and secure. How are you doing, Bob? Alright, he tells me good. It's secure to his nose. Now I'm just going to attach my connector. And then I called down to X-ray to get a chest X-ray to confirm the placement of my tube. And I want to wait until I get the confirmed X-ray saying it's in the stomach before I attach it to suctioning, start any tube feedings, or just use the tube. I could also use these pH sticks too to test the aspirate of the tube. Alright, so now I got the call. The tube is confirmed, it is in the stomach. So now I want to make sure my suction works. And it does, and it needs to be on low intermittent suction. So now I can just connect it to this because we got the confirmed placement. Alright, and if it didn't stay or if I wanted to just be extra cautious, I can use this tape. This way, wash my hands again. And then just safety pin through the tape in his gown just to assure that it stays upright. And then it can prevent, in case if it were to leak or if there was extra in the tube, it won't get all over the place. Alright, so I want to make sure to document the time, and the date, obviously the size of the tube, what nair I placed the tube in, and then document that after I got the confirmed chest X-ray, I started the suction on low intermediate, document how Bob tolerated, which he tolerated well. I want to continue to monitor for any signs of respiratory distress or any complications. A lifespan modification could be if I had a pediatric patient, maybe a shorter tube because they won't have such or as long of a way down, or even maybe a smaller tube just in case they couldn't tolerate one that big. And then Bob is in a low, comfortable position. I made sure he's safe. So after I document, I would make sure to clean up the rest of my supplies and wash my hands and then leave the room.